So thanks for having me. Sorry I can't be there in person. Today, I'm going to address a topic that was really raised by my patients and something I've been thinking about for a while now. But one of the things that, so just by way of background, I'm a clinician, I'm a pediatric neurologist, but I run the NF Center at NYU and I see adults and kids with NF. And one of the things that we all know about NF is that there really aren't very many effective treatments for NF available. And as we were just hearing, there really aren't good ways of preventing symptoms of NF. We have some treatments like chemotherapy for optic pathway gliomas, imatinib for plexiform neurofibromas, things like that, but we don't have anything. Part of the challenge in finding out which diets or supplements might work for people include issues like the fact that there's symptoms that vary so greatly from person to person with NF. It takes many years for some symptoms to develop. And it can be really hard to change someone's diet. Or
Lily, come. Addie, come.
Jeff, could you mute?
Sorry. It can be very difficult to assess lifestyle changes like diet or taking supplements because it's really hard for people to impact their life for long stretches of time. There's also quality control with supplements. Unfortunately, because supplements are not FDA regulated, it's really a bit of a crapshoot. When you buy a supplement, you don't really know what you're getting. Sometimes it's just rice flour, sometimes it's filled with things like formaldehyde. So you really have to look for reputable brands. So it's very difficult for us as clinicians. Our job is always to weigh the cost and benefit of various treatments. And because of these issues, it's really difficult to make those assessments for diet and supplements. A lot of patients are interested in prevention as opposed to treatment. And I think supplements potentially have some role in prevention, and they may also have some role in treatment. It's also important to think about whether or not you're treating the whole disease, or you're treating certain symptoms. For instance, I use riboflavin to treat headaches very frequently, and that's a well-established treatment, but it's not really treating NF. And then the other thing that we also have to keep in mind is that we think of diet and nutrition as natural and as natural therapies. And that may be true, but natural doesn't mean safe. There are many, many things out there that are natural that are not safe. So this beautiful flower is the foxglove plant, and it is used to derive a very famous and old medication called digoxin. And digoxin is not something that you would think of as a natural substance. It's used for cardiac patients all the time. And it's used to treat heart failure and rhythm problems. Companies make money off of it, but it has lots and lots of side effects. And I think the presumption often is that something that's natural is going to have side effects, and that certainly is not the case. And many of our medications are quote unquote natural. So lovastatin, which treats cholesterol, is derived from red yeast rice. Penicillin is derived from fungus from all over the place. Morphine comes from poppies. Taxol, which is a drug for breast cancer. Again, chemotherapy, not something you think of as a natural therapy, but it's derived from yew trees. Vincristine, which is used in kids with NF who have optic pathway gliomas, is derived from a flower called the rosy periwinkle. Curare is from a plant called strychnine. And aspirin comes from willow trees. So that doesn't mean that we should discount natural therapies offhand, but I think it's just a word of caution that just because something is quote unquote natural, we can't just assume that it's safe and well tolerated. So as I mentioned before, a lot of patients have sort of raised issues around diet. I became interested a few years ago in trying to figure out what things people are delving into in terms of diet and in terms of supplements. So I did a deep dive into bulletin boards on the web, things like the Inspire Network. to try to figure out what diets are being discussed within the NF community. And the ones that are mostly being discussed these days are ketogenic diet, the paleo diet, low-fat diet, vegetarian diet, and Mediterranean diet, and how these diets, different diets may impact neurofibromatosis and the symptoms of NF. And unfortunately, there's essentially no specific data. There's lots of anecdotal stories about one of these diets or any of these diets helping particular people. But unfortunately, we just don't have good data to say that any of these diets would be particularly helpful for NF. That being said, if patients approach me wanting to adapt their diet to try to prevent potential symptoms down the road, we do know that some diets can be preventative when it comes to cancer more in general. So both vegetarian diets and Mediterranean diets have been shown in large population studies to have benefit in the general population. It hasn't been specifically tested in NF, but particularly NF1, there is definitely an increased risk of cancer during the lifetime. And so it seems reasonable and hopeful that maybe following either a vegetarian diet or a Mediterranean diet might be helpful in preventing cancer down the road. And in general, I think we know that these diets tend to be healthier and people tend to live longer and more functional lives while watching their diet in these ways. So another question that I had was, what supplements are people using? So a few years ago, we did a survey with the NF registry that run by the Children's Tumor Foundation. And we got almost 1,500 completed surveys back from people. And of those 1,500 people, about 25% are regularly using supplements specifically to treat their NF. Children and young adults were the most likely to be using supplements. And 90% of people using supplements plan to do that for long-term and going forward. 2/3 of those using supplements use 2 or more supplements at the same time. So the list of supplements that people cited as being used is very long, and I'm not going to go through this whole list, and I'm sure that some of you have your own favorite diet or supplements or vitamins that you use, and you can see if it's on this list. But the things that were used most are up here at the top. So vitamin D3, turmeric or curcumin, fish oil, B12, melatonin, marijuana or CBD, coconut oil, vitamin C, bee propolis, and vitamin B2. So we're going to dive a little deeper into some of these. So just of that top list, we split it up by NF1, NF2, and schwannomatosis, and you can see that there's people using all of them in all 3 disease conditions. In NF1, we found that we looked at which symptoms people are trying to treat with their supplements, and general health or skin neurofibromas were the most common reasons to be taking supplements, with a variety of other symptoms that you can see there. For NF2, general health, but also trying to treat vestibular schwannomas, headaches, and pain, and other tumors associated with NF2. And for schwannomatosis, again, general health was the #1 reason, but also to treat schwannomas and pain. So having sort of seen what people are using, I tried to delve into different supplements to see, I feel like if someone comes to me and they say, well, I'm going to take a certain supplement, in my medical training, I may not have learned anything about quercetin or turmeric or a specific supplement. So I felt like it was my responsibility to try to delve into some of these a little bit more to determine which ones have some scientific rationale, which ones might be safe, which ones might not be, and what it might be doing in NF. So I tried to answer these questions for a variety of different supplements. Vitamin D is one of the more common supplements used, and it's also one of the more common supplements prescribed by physicians who take care of people with NF. We know at this point that vitamin D, which is a fat-soluble vitamin, which is found in a lot of different foods, can prevent cancer and can maintain bone health. And almost everybody with NF1 has low vitamin D levels, and they're at higher risk for osteoporosis and other bone issues later on in life. And so it's become almost standard of care to treat people preventatively with vitamin D. It's also been mentioned as potentially being involved in preventing skin neurofibromas. That data is not very clear. But if you look at adults with NF who have higher vitamin D levels, there's a tendency to have fewer cutaneous neurofibromas, but it's not at all clear that that's a direct cause of higher vitamin D levels. Vitamin D increases the absorption of calcium and phosphorus, which helps bones. And it can also induce cell differentiation and decrease cell proliferation, which can slow or prevent tumor growth. So, as I mentioned before, the data does show that there are low levels of vitamin D in many people with NF1, and that treatment can improve bone density. And vitamin D is very safe. There's very little reason not to take it on a regular basis. And so at this point, in my practice, I recommend vitamin D for virtually everyone with NF1. And probably the second most commonly used supplement is turmeric, also known as curcumin. Curcumin is the active chemical in turmeric. It's a root that's used in foods to color foods and also to flavor foods, also used in cosmetics. And people use it because they think it may be neuroprotective, anti-inflammatory, modulate the immune system, be anti-proliferative, meaning slow cell growth, and also may sensitize people to better effects of chemo or radiation for treatment of different tumors. In general, it's being discussed within the NF community as ways to treat the tumors of NF1 and NF2, as well as general health. And we do know that, chemically, curcumin does cause cell death through inhibition of the mTOR pathway, which is involved in NF. It also may elevate vitamin D levels, and it may reduce COX-2, which is an inflammatory marker. There is some small amount of data to support curcumin for NF-related tumors. So in cell cultures, MPNST T cells died more easily when treated with chemotherapy and curcumin. Curcumin slowed schwannoma growth in various schwannoma models. And there is a very small clinical trial which looked at using curcumin and Mediterranean diet together to result in tumor reduction. So I'm going to spend a minute talking about that trial in just a minute. So is turmeric safe? It might inhibit certain chemotherapy. So if you're on chemotherapy, it's probably not safe. It may also interact with some medications, and it can increase bleeding risk. So it's not entirely without side effects. Some people report some stomach upset as well. Here's the clinical trial that I mentioned. So this was from 2017. It was a European trial. It was very small, 6 patients total. 11 patients total, all adult patients with NF1 who were followed for 6 months. 2 people didn't do anything. They basically just followed their regular Western diet. 3 adhered to a strict Mediterranean diet. 3 took turmeric with a Western diet, and 3 took the Mediterranean diet with turmeric. They measured curcumin levels in the blood. So people who were taking the turmeric supplements but were on the regular Western diet really didn't show much increase in their blood levels of turmeric. But the patients that were on the Mediterranean diet and turmeric had very high levels of turmeric in their blood. And the only people that they saw have any impact of tumors were the patients that took turmeric and were on the Mediterranean diet. And again, very small sample size. There were 2 patients that had cutaneous neurofibromas that saw reduction in the number and size of cutaneous neurofibromas. So this is a patient before the trial, and this is a patient during the trial with, you can see more space between the neurofibromas. And there was one patient with a known plexiform neurofibroma in the face. You can see it outlined here that did show some shrinkage during the 6 months of the trial. Now, the reality is that plexiform neurofibromas sometimes shrink on their own. With one patient showing a response, it's really hard to make generalized predictions that turmeric or curcumin and the Mediterranean diet will cure or treat plexiform neurofibromas. But I do think that there's enough information here that it deserves at least being looked at in a larger cohort of patients in a more controlled setting. Carnitine is another supplement that's being talked about a lot these days, in particular for treating muscle fatigue and strength. Carnitine is a nutrient that aids absorption of fatty acids and helps the mitochondria, the energy pumps in the cells to function better. And the idea behind L-carnitine is that it may move long-chain fatty acids into those energy pumps, the mitochondria, to produce more energy in the muscle. So I'm going to again talk about a small clinical trial that is published that is, I think, very interesting and potentially very promising, but I think again needs more study. This is a trial done down in Australia, looking at L-carnitine supplementation for muscle weakness in kids with NF1. This was 6 kids between 8 and 12 years of age, treated for 12 weeks with levocarnitine tartrate, which is a readily available supplement. There were no adverse side effects reported by anybody. And these are the results. It's for each of these figures, there's a rate. Each dot is one of the patients. And on the side here, you can see what they were testing. So in this first box, for instance, they tested grip strength. And they took all the people with, they measured their grip strength at baseline and then 12 weeks of treatment. And they compared, and the horizontal line is the average. So there looked like there might have been a tendency for the grip strength to be a little bit better, but it wasn't statistically significant. But when you looked at strength in the lower extremities, like in the legs and the ankles, you saw a change between baseline and 12 weeks that was statistically significant. And you can see again, this change towards 0 would be compared to the general population, so to almost normal strength. And that held true for ankle movements. It held true for long jump, something called the 6-minute walk test, which tests fatigability. And then also handwriting with speed was looked at, which is a fine motor skill, and that was not significantly improved. So again, a really small trial, a very safe supplement, unclear what these changes would, if they would last long term, but definitely something that deserves additional evaluation. Bee propolis is another supplement that is talked about a lot within the NF community, both for NF1 and NF2. It's a resinous mixture that bees make when they're building their hives. And it actually contains hundreds of different chemicals. And it really depends where the bees live and what they're eating that determines what the chemical makeup is of bee propolis. So it makes it really hard to study bee propolis in general, because depending on what the bees are eating, you may or may not have the chemicals that actually impact NF. So New Zealand propolis has high levels of 2 chemicals called CAPE. In New Zealand it has high levels of CAPE, and Brazilian bee propolis has something called ARC. And these have been looked at in various cell culture models and animal models, and may have some anti-tumor properties in both animal models and cell culture models. It's never been tested in a clinical trial, though there are anecdotal reports, particularly by a physician in Japan, who has reported some individuals with very marked response to these to supplements with bee propolis, which I think seems out of proportion to likelihood. But that being said, many people do take bee propolis for their NF. And it's generally safe unless you have a bad allergy to bees, and those, for people who have a bad allergy to bees, it's definitely something to avoid. In the interest of time, I'm going to skip B2, except to say that there's nothing really specific about B2 for NF, but it is very effective in treating migraines. So people with migraine headaches, B2 can often be a very safe and effective supplement. So just in the last minute here, I'm just going to summarize what should people with NF do. You can consider supplements for symptomatic treatment. So riboflavin and or magnesium have been shown to be beneficial for migraines. I didn't talk in detail about melatonin, but some people with NF have difficulty with sleep. That can be a common issue, and melatonin levels are actually low in people with NF. And so it may be an effective sleep aid for some people with NF. Some people use marijuana and CBD for pain control, for neuropathic pain, and that's been shown not in NF, but in other conditions to be an effective pain therapy. Itching can be a big issue in people with NF. Quercetin and ketotifen are both things that can help with itching. I didn't talk about it today, but acupuncture can also be effective in modulating pain. Meditation, mindfulness can also be, there are clinical trials for meditation and mindfulness for anxiety and pain, and specifically in NF, that can be very effective. And then disease modifying or prevention, vitamin D, as we discussed, a healthy anti-cancer diet may be helpful, and we'll hear more about diet in a minute. Maintaining a healthy weight. Just in general, eating less red meat, particularly processed meat, probably reduces cancer risk. Fewer processed foods and preservatives, reduce sugar and simple carbs. All of these are just sort of general healthy recommendations that are not specific necessarily to NF. And regular physical exercise also is very effective in preventing cancer. So you should consult with your healthcare providers before using any diet or supplements, because there may be interactions or risks that you're not aware of, especially if you're on chemotherapy or in a clinical trial. And ask questions of your healthcare providers. We don't know everything by any stretch of the imagination. And I think the NF population is going to bring to us ideas about things to look at and things to study and things to consider for treatment. And you can actually do a good job in educating your providers about alternative therapies. And then you can also educate your naturopaths, your acupuncturists, massage therapists, et cetera, about NF so that they can become aware of NF. So in the end, I think we are going to need more controlled studies. So advocacy for funding for controlled studies through the DoD, NIH, Children's Tumor Foundation is something that's going to be necessary to move alternative therapies to standard treatments. So with that, I will stop and turn it over to Dr. Brassier, and then we can answer questions at the end.
All right, is everyone able to see my slides? All right, so now you've had this wonderful presentation from Dr. Yohay talking about all the things you can maybe do from a diet and supplement standpoint to improve your health. And I'm going to kind of go the opposite route and tell you a little bit what might happen if you disregard all that advice and do all the things we know we shouldn't do in regards to our diet and health. So let me see. I think for those of you that have been here today, it's probably not going to come as much of a surprise to you that NF1 is a very clinically heterogeneous disease, meaning when we're actually looking at patients, we see a very, very different phenotype from one person to the other. So somebody might have all the tumor manifestations, and someone might have bony disease and a lot of the skin findings, but none of the tumors. And that can be true even within individual family members, okay? So I'm a neuro-oncologist, and in fact, if any of you guys come up to St. Louis and have a child that has neurofibromatosis with a symptomatic optic pathway glioma or other central nervous system tumor, you'll probably be seeing me. But the things I care about the most are the tumor manifestations. And so when we're specifically thinking about tumor manifestations in NF1, there are things that we do know that influence whether or not a tumor forms, okay? And so the most simple thing is just genetic mutation, right? We know everybody with NF1 has one inherited copy of the NF1 gene, and they also acquire another NF1 mutant allele, typically at least in their tumors. So this is true of most of the benign tumors, including the optic pathway gliomas and the plexiform neurofibromas, that they'll have 2 mutated copies of the NF1 gene present in those tumors. All right, now we think that mutation occurs by random chance, where the cell is trying to multiply its DNA so it can undergo a process of cell division. And when it does so, it introduces a genetic mutation just accidentally as it's trying to copy that DNA, and it doesn't get repaired correctly. And unfortunately, then they, then are predisposed to developing a tumor in that spot. So we do know, though, that there are some non-random factors that control that as well. And I think you guys heard a little bit already about why we don't like to use radiation in patients with NF1, because we do know that that increases the risk of tumors. And in this case, it actually induces breaks in the DNA. And if a cell doesn't die after it's had a lot of DNA breaks introduced, then it can actually repair those. And in that repair process, can introduce additional genetic mutations. And so you can actually get multiple different types of tumors arising after radiation, including higher grade lesions like high grade gliomas and MPNSTs, which is a lot of what we worry about. But are these the only causes of variation in these tumor phenotypes in patients? And I think you guys know what I'm going to argue for, and that's that no, there is actually other causes of variation that might actually be controlled by our lifestyle. So thinking about this from a different way, so if we're talking about from the viewpoint of a single cell, we know if that single cell acquires a genetic mutation, or in the case of NF1 already has a genetic mutation and then gets a second mutation in that remaining copy of the NF1 gene, it can go on to form a tumor. But we also know it can do a lot of other things other than forming tumors. So every mutant cell does not go on to form a tumor. And if that's the case, then can we identify what controls the balance between these tumor and non-tumor phenotypes? And ultimately, can we find a way to predict what factors shift that balance more towards the tumor forming spectrum of that balance? And then can we identify how they do it so that ultimately we can design therapies specifically geared to prevent that from happening, okay? And so the factor that I'm interested in, and then I'll talk to you a little bit about today, is obesogenic diet exposure. All right, so this is a very busy slide, and it's not really anything you have to remember any details about. The whole point of this is really that obesity or an obesogenic diet, meaning a diet that is known to produce obesity, and most of the studies are either high fat diets or high fat and high sugar diets, okay, that are doing that. So in these studies, these have been shown to contribute to either tumor formation, tumor progression, drug resistance, or cancer recurrence in multiple different types of cancers, particularly in adenocarcinoma, types of tumors in adult patients. Okay, that's where the majority of this work has been done. When we're thinking about the pediatric patients, though, we can see some suggestive trends in the population. So this is on the left, you'll see a curve from the CDC, and it's just looking at the number of people that have obesity in the US, and you'll see that this curve has continued to rise over time. So it's already high, it's already rising, and this is true for obesity, severe obesity, and pediatric obesity, although pediatric obesity is not really shown on this slide here. And then if you look at pediatric gliomas, so gliomas being a type of tumor, a type of brain tumor that children can develop, and when we're talking about the NF1 optic pathway gliomas, those are a type of glioma. We see that the incidence rate of the gliomas is rising over that same period of time. And this is true across all ethnic groups that are born inside the US, although there is a different baseline level of tumor formation by ethnicity. And then when we look further at these trends, we can actually see that the most profound increase was noted with low-grade glioma, specifically a subtype of low-grade glioma called pilocytic astrocytoma, in the 0 to 3-year-old age group. So that's where the trends seem most prominent. So then if we're thinking about this in terms of these two curves that are rising and trying to determine if there's a correlation between the two and having the most profound effect in very young children, we think then that you have to consider not only the exposure of the kid to an obesogenic diet or obesity, but also what happens to the mother. Okay, And so that's what we've set about to do here. So thinking about maternal obesity and whether or not there's any data linking that to pediatric brain tumors, there is, in fact, some data looking at that. And so this was a study that was done in Israel. Again, the exact details of the study, not super important. But what you should know is that children of obese mothers were found to have increased incidence of multiple types of tumors. And this includes brain and ophthalmic tumors, okay? Where you're having about a 4 times increased risk of developing a brain tumor if you were born to an obese mother compared to a non-obese mother. Now, these studies are very difficult to do in the US because of our fragmented healthcare system. So we do not have an equivalent study here in the US, nor do we have any of these specific studies in patients with NF1, because you can imagine if the studies at baseline are hard to do and then you throw a genetic disorder on top of it, it makes it even more challenging. But what we do have is kind of a suggestive data to suggest that obesogenic diet exposure might also have an effect in NF1, specifically in optic pathway gliomas. And so this was a study done by Kim Johnson and David Gutman a few years back, and they were actually looking at a bunch of maternal and infant factors to determine whether or not they could correlate those with tumor formation in kids with NF1. And what they identified is that infants that were born with higher birth weights had an increased risk of developing optic pathway gliomas. And this wasn't noticed for all the brain tumors that they developed, just the ones in the optic pathway. All right, now birth weight is a very complicated factor. It is certainly not only driven by maternal diet, but that is one of the things that can affect it, is maternal overnutrition or maternal obesity. And so thinking more in that line, specifically about the maternal overnutrition standpoint, we've also seen some evidence in mouse models that maternal overnutrition can affect the development of the brain. So this is actually in a rat model where they looked at the female rats exposed to either a balanced diet or a high-fat diet, and they saw increased proliferation, okay, meaning where our cells are dividing here. That's a phenotype that's very important for us oncologists that we like to talk about a lot, in the developing brain. So this is an area called the hypothalamus. It's a major integrator of diet and regulatory signals, and we see increased numbers of these proliferating cells, which here are the bright red cells in this region of the brain. And this area surrounds this nice space that's black here, but is actually in the brain. It would be a fluid-filled space called the third ventricle. And this is even more interesting to us because we have data from animal models to suggest that the cell of origin for the NF1 optic pathway gliomas actually comes from this region of the brain. And so in the embryo, we would expect that the NF1 optic pathway glioma cell of origin would be here, and then it would migrate later into the optic nerve and develop a tumor postnatally. Okay. So based on all of that information, we hypothesized that we could take an obesogenic diet and expose, in this case, mice to this. This is the model system we use. And that we would see changes to the NF1 optic pathway glioma cell of origin, and that would lead to increased tumor formation. And in fact, that's exactly what we saw, right? So the first thing we did here is we set up a cohort of animals and exposed them to this obesogenic, high-fat and high-sugar diet, starting at about 4 weeks of age. So mice are typically mature by about 2 to 3 months of age. And so we mate them together at 2 months. But by that point, they've been on that diet for 4 weeks. They show elevated weights compared to their control diet fed colleagues. And then we collect the fetal brains towards the end of their gestational period. So kind of close to the late 3rd trimester in humans. And when we do that, we don't see changes in the fetal weights. And this might just be because of the nature of mouse pregnancies, where they have lots of different pups and there's a limited space in the abdominal cavity for all those pups to grow. But what we do see is still those changes to the developing brain. And we wanted to replicate this first in wild type animals, so animals without an NF1 mutation, so we could make sure that this observation that had been previously reported was true. And so in our hands, we did see in this region of the brain, okay, where the NF1 optic pathway glioma cell of origin resides, we saw increased proliferation. And we also saw increased glial differentiation in this area. So glial differentiation for us is important because the types of tumors we're interested in are gliomas. And so usually those are going to be characterized by cells that either look like astrocytes or oligodendrocytes. Those are both glial lineages in the brain. All right, we looked for astrocytes. We didn't see any. Astrocytes normally develop after birth. And so that may be why we didn't see reproducible changes for there. But what we did see was an increased number of these cells that stain for the marker OLIG2. And that's a cell marker that turns on as you're differentiating from a very, very immature cell that we call a neural stem cell into the oligodendroglial lineage, okay? And those can then go on mostly to form oligodendrocytes, but you can't actually, they're not really fate committed at that point. So some of them will go on to form astrocytes as well. But importantly is there are glial lineage, and we are seeing differences in glial differentiation. All right, so we have these changes then in the developing brain. And the next question we wanted to know was whether these phenotypes were still observed in the NF1 mutant mouse brains, okay? And the reason for that is because we know patients with NF1 have decreased or changed in their metabolism. So patients with NF1 have decreased rates of obesity. They have decreased rates of type 1 and type 2 diabetes. They have decreased rates of hyperglycemia, so high glucose. They have reduced rates of insulin intolerance. And so all of these things can be observed in the mouse models as well. And this I'm just showing you is from a prior study that's been done that was just looking at glucose tolerance, where they fed these animals a given amount of sugar orally, and then they monitored their blood glucose later, and the mice with NF1 didn't get quite as high as the wild type mice did. And in fact, we see that in our animal model too, where we're looking at the fetal serum here, right? So we've taken blood from the fetuses and we're looking at the levels of glucose in there. And we know that in our wild type animals, so again, those are the ones that don't have mutations in them, we see increased levels of glucose in that serum. And we might see that in the NF1 mutant brains as well. But when we're looking at those, what's really notable is that when you shift from the wild type to the NF1 mutant, you're seeing decreased rates of glucose under both the conditions. So comparing the control diet on the left to the control diet on the right, or the MAD-OB cohort on the left to the MAD-OB cohort on the right, you could see that they're decreased. So it was very important to us to figure out, okay, we know NF1 has effects on metabolism. Are we still seeing these same changes to the brain development? And we actually do. And we tested this on 2 different models of mice that had a single copy of a genetic mutation in NF1, and each of these had the genetic mutation was originally identified in patients and then engineered into mice. And in both of those, when we exposed them to this obesogenic diet, we saw a similar phenotype. Now, kind of in the same vein, the next question that was very important to us to answer was whether this effect was due to diet or maternal weight, all right? And the reason for that, again, if we're talking about an effect that's primarily, if it were primarily driven by weight, by maternal weight, in this case, that's what we're talking about. We know that you can develop NF1 through 3 different mechanisms, right? You can have this arise spontaneously as when you were developing as a single cell in your mother's womb there, or you can inherit it from the mother, or you can inherit it from the father, right? And so if this was primarily driven by maternal weight, and you have decreased rates of obesity in patients with NF1, you might expect that that would really significantly change your risk depending on whether you inherited your gene from your mother or your father, or whether it was coming spontaneously. So we took a cohort then of mice and we exposed them to this high-fat, high-sucrose diet during pregnancy. And so they were not overweight compared to the control diet cohort, but their offspring did still have the same phenotype that we observed with the NF1 optic pathway glioma cell of origin. So we still saw changes in the proliferation and the differentiation. Okay, and then we took another cohort of animals just to validate this, and we took them on the same way that we treated the MAD-OB cohort. We started them on that high-fat, high-sucrose diet at 4 weeks of age, but then when it came time for them to mate, we switched them over to a control diet. So that all during the pregnancy, they were on a control diet. And in those animals, they behaved indistinguishably from wild type. So altogether, that's telling us then that this really seems to be more of a dietary phenotype and not a weight phenotype. And so patients that have mothers with NF1 would be expected to have similar risk as patients that have wild type mothers based on these information. And so then comes the real important part, is what does this do to tumors? And so in order to answer this question, we utilized a couple different animal models where we can actually have one copy of the NF1 gene that we call germline. So that's present in every cell of the body. All right. So that's a mutant copy of that gene present in all cells. And then we cause the NF1 gene to be lost, that second copy, in another subset of cells. And depending on what that original mutation, that germline mutation is, we can vary the amount of tumor formation that we see at baseline. So in this model system that I'm showing you here, this one has a particular genetic mutation where we only see animals forming tumors about 20% of the time. All right. And so we asked then what would happen if we expose them to this obesogenic diet. And so this is both maternal and postnatal exposure. So we wanted to really replicate what probably happens in families where if mom is, eating a very high fat and high sucrose diet, probably the kids are too. And when we do that, we see increased volumes in our optic nerves. Okay. And so this is kind of going back to a basic definition of what a tumor is, all right, which is a lesion that occupies space that is proliferating. Very basic definition. Okay. So it has to be dividing the cells and it has to be occupying some amount of space, pushing normal structures aside. So we have the space occupying part done here. So we're seeing this volume is increasing with this obesogenic diet exposure in these mice. So then we looked at the other phenotypes. So we do see increased proliferation. Again, this is this lower panel, the Ki67 positive cells are increased in this. And we also know that these tumors show infiltration of inflammatory cells called microglia, and those stain positive for this marker called IBA1. And we see increased rates of that in there. So altogether, this is showing us that really what we have is a separation in these two groups where if you're looking at them by a volume by proliferation curve, which we've found previously useful to demonstrate where optic pathway gliomas are forming and where they're not forming, that really few of the control diet animals are forming optic pathway gliomas, and this is what we'd expect based on prior results. But when we expose them to this obesogenic diet, we see far more tumor formation, and quantitatively that ends up being at about 67% compared to the 11% controls. All right. So then we also wanted to know what would happen if we had a model that had a very high rate of tumor formation at baseline. So in this particular model, we get almost 100% of the animals forming tumors by 3 months of age. And we wanted to know, all right, what happens earlier in this time point, all right, when these animals do not normally have tumors. And so when we looked earlier, we saw, again, significant increases in the volume of these nerves when they were exposed to this obesogenic diet compared to the control diet. We saw those same changes with increased proliferation, increased IBA1. And really, when you're getting down to it, we're looking at maybe one of our control diet animals that we could say possibly has formed a tumor by 6 weeks of age, but virtually all of the obesogenic diet groups have formed tumors by 6 weeks of age. Now, this is for us very clinically important because when you're talking about factors that are contributing to prognosis in children with optic pathway glioma, the age of onset is one of those. So kids that come in that are symptomatic from their optic pathway glioma earlier have poorer visual outcomes compared to those that don't. And we know the visual outcomes and the other neurologic symptoms that can go along with that are really what we're caring most about in these kids, because these tumors are not typically growing fast enough or big enough that they're actually going to threaten life. So really what we care about is, are they causing vision problems? Are they causing endocrine problems? Are they causing other neurologic deficits? And so I think this potentially suggests that we could see a link between this obesogenic diet exposure and an increased risk of vision loss, okay, based on the accelerated tumor formation. So in summary, so far, what I've shown you is that we do have an effect of the maternal obesogenic diet exposure on the NF1 optic pathway glioma cell of origin. This effect is due to diet rather than weight. And that when we have the tumor models and we expose them to this obesogenic diet, and this is both maternal and postnatal exposure, we see increased tumor formation and we see accelerated glioma formation. Okay. Now, this is really the beginning of a story, not the end of a story. Okay. And I think we have several questions which remain. I think very important for patient counseling is going to know what's the effect of maternal compared to the postnatal dietary exposure on the tumor formation specifically. And thinking about that in more detail, if we have maternal exposure and then we're able to switch the kids to a better diet, when they're still young, will we have decreased rates of tumor formation? So I think that's going to be a critical question. Also, I think it's very important just for anyone who's under receiving counseling to know whether they need to avoid all the bacon or avoid all the candy. And so that, I think, to finding out what contribution of these different dietary components is really causing this effect, it will be critical. Really, we need to then verify, I suspect that this accelerated tumor formation will result in poorer visual outcomes, because we do see accelerated tumor formation resulting in poorer visual outcomes in children. But we do need to validate that and determine if that's happening. And then I do think another question that's very potentially interesting is trying to figure out how competing risk factors influence tumor formation. And in this case, obesogenic diet, which I think is promoting tumor formation, versus asthma, which we have both human patient data and mouse data to suggest suppresses glioma formation. So if we have these two competing, what happens to our glioma risk? And this is a very real world circumstance, because when we're talking about urban environments in particular, we have a lot of areas that we call food deserts. These are characterized predominantly by low availability of high nutrient foods, but they do also tend to be high in fat and high in sugar, the foods that you can get. All right. And then there's also, in these areas, they often tend to correlate with areas that have higher rates of environmental particulate exposure, which can lead to higher rates of asthma in the population. So this, again, would be a scenario that could actually really happen in many patients, especially those that are living in urban. Sorry, I think I muted myself. Getting back to the whole purpose of us doing this study in the first place, the last thing we want to know is how actually does obesogenic diet affect these changes on the optic nerve? Because ultimately what we'd like to do is find a way to either prevent optic nerve glioma formation or treat it afterwards. And we know that dietary modification is extremely hard. Okay, I'm not able to successfully do it for myself, and I actually know all the bad things that diet does for people. So it's a very, very challenging thing to do, to get people to change their diet when they have all these cues from the environment and from advertising shoving the fat and the sugar in their faces constantly. So if we're able to actually find out how this this bad diet affects things molecularly, we might also be able to find a way to bypass the effect of that diet on the optic nerve. Okay. And with that, I think I will conclude and then be available here to address any questions.
Thank you both so much. We're running a little bit short of time, but there may be some questions. I know we have one online. Are there any questions in the room for these outstanding thinkers? I don't see any questions from the room, but I think we have one online.
Hi, this is Kim. This one is for Dr. Yohay, and it is about your suggestions for the vitamin D supplement. One is for a 5-year-old. What is your suggested dosage amount for a 5-year-old? The other is for an adult.
Yeah, so just in general, in our clinic, what we recommend for pediatric patients, through adolescence is about 25 micrograms a day or 1,000 international units. And for adults and older kids, 2,000 units a day, which is 50 micrograms. If we have somebody that we know has a very low vitamin D level, sometimes you can do weekly dosing instead of once a day. And in that case, you do 50,000 units once a week. And that's another way of treating people with low vitamin D levels. And that would just be for adults.
Well, thank you very much. Are there any other questions? All right, well, thank you both for a wonderful presentation. We have a lot to learn. I'm glad to see that you are working. It's questions we've had for a long time. Thank you.
Take care.
Yeah.